Hello everybody, this is Dr. Meenakshisundaram from Chennai. Today we will see about diabetic foot. Why diabetic patients are more prone for foot complications and what you can do to prevent them. Diabetes, as I said earlier, is not only increased blood sugar levels, it is a cardiometabolic disease which can affect the entire body, starting from the eyes to the heart, kidney, foot, nerves, blood circulation, all of them can be affected. And foot complications are also quite common in diabetic patients. So, why does diabetes affect the foot and how does it do so? There are three mechanisms. Number one is called diabetic neuropathy, where the diabetes affects your nerves. Number two is diabetic vascular complication, peripheral vascular disease, where it affects the blood circulation to the foot. Number three is hyperglycemia, very high blood sugar itself can damage the foot by certain mechanisms. So we'll see them one by one. See, coming to diabetic neuropathy, we've got three types of neuropathy. It can be sensory neuropathy, motor neuropathy, or autonomic neuropathy. In sensory neuropathy, diabetes affects your nerves which carries the sensation from the foot. So initially you can have pain or pin pricking sensation or burning sensation, etc. Later, as the disease progresses, there may be loss of protective sensation and complete numbness also in some patients. So normally when we keep our foot on a sharp object, we reflexly take our foot. It's a complete autonomic reflex which is not under control. But that is because of the nerves working properly. If the nerves are affected, this reflex is not there. Patients won't feel that they are stamping on a sharp object and it might go in and damage the foot. That is a sensory neuropathy. Then comes motor neuropathy. In motor neuropathy, normally we have got muscles in the intrinsic muscles and larger extrinsic muscles. Intrinsic muscles, we have got muscles on the top of the foot and in the bottom of the foot. When both the muscles work normally, you have a normal foot architecture. Supposing if one of the muscles is damaged, the nerve supply to that is not working properly, that muscle is atrophied, other muscle overworks, then you get deformities. For example, it can be like this. It can be a claw toe or a hammer toe or pes cavus or pes equinus. So many deformities in the diabetic foot happen because of the motor neuropathy, damaging one set of muscles alone. So what will happen is, because of the deformity, the pressure changes are significant in the foot. So there is an equation in physics called Pascal's law, which says pressure is equal to force by area. Every time you keep a step, when you lift the other foot, your entire body, that is the force, acts on the foot, in one foot, that is the area. The foot is normal, it can take up the pressure uniformly. Supposing if the foot is deformed, one particular area is projected up, that will take up your entire body weight of 70 to 80 kg. So repeatedly when you keep walking, the repeated stress will damage that area, break down the skin and cause ulcers. It can cause calluses and later diabetic neuropathic ulcers. This is how motor neuropathy affects your foot. Third is autonomic neuropathy. In autonomic neuropathy, normally our sweat glands are responsible for the maintaining the temperature in the foot. Supposing they are not working properly because of autonomic neuropathy, we may get dry foot which can lead on to cracks, fissures, ulcers, etc. So that is and not only that, the autonomic neuropathy can cause something called arteriovenous shunting. Blood from the arteries flows directly to the veins, bypassing the tissues and the capillary circulation. So because of that, the tissues will not get enough blood. So they will go in for tissue hypoxia and necrosis later, leading on to ulcers. So this is the second mechanism. So apart from this, high blood sugar itself can affect your foot. Because the blood sugar is very high, it can affect the immunity. So all immune functions, including neutrophil chemotaxis, phagocytosis, and so many other functions will be affected in the high blood sugar level. So because of that, we are prone for infections, including fungal infections or bacterial infections. So this is how diabetes makes you prone for foot ulcers. So what can you do to protect your foot? Number one is, prevention is better than cure. Like in any department of medicine, prevention is the best strategy for diabetic foot ulcer also. In fact, it is easier to prevent the foot ulcer than to treat it. It is easier, much economical and good for the patient also to prevent it. So what you do is, number one is keep your blood sugar, blood pressure and lipids under very good control. That is the most important thing. Second thing is, there are several do's and don'ts for diabetic patients. I'll tell you the don'ts first and then the do's. The don'ts are, don't do any home surgery. If you see a callus or corn, don't go ahead and cut with your blade in the house. It may get infected. it may cause problems later. All major complications start with a small and minor infection. So be careful. Even if it is a minor one, go to a doctor and get treated by him. So don't do any home surgery. Do not apply hot water or hot fermentation to the food. Do not dip your feet in the hot water. And then do not apply any homemade acidic substances or strong substances on the food. All of them can damage your food. Next is, do not walk barefoot. Particularly in our country, for religious reasons, we go barefoot walking. People go for, in the temples, people can go for long walkings barefoot. All that may not be very good for diabetic patients. Be extremely careful if you are going to do a barefoot walking. As far as possible, avoid barefoot walking. Then, do not wear a ill-fitting shoe. Always be careful with the shoe. The shoe should have an adequate toe box, and you should buy a shoe in the evening time and not in the morning time. Because sometimes you may get a swelling towards the evening. So if you buy in the evening time, it will fit the foot well. If you buy it in the morning time, if there is swelling in the evening, it may become tight and damage your foot. So this is another thing. Then what are the do's? Number one is, as I said earlier, check your feet every day. Check for any changes in the color or any warmth or any infection, any deformity, etc. Corns, calluses, any of them is there, see your doctor immediately. Number two is, check your footwear also. Check your footwear before wearing it. See if there is any foreign body inside. There will be some pebbles, there will be some any sharp objects. So be careful, check for that and then wear the footwear. Third is, be careful in between the toes. In between the toes, it should never be moist, keep it always dry. And overall, you can apply a moisturizer to keep your foot moist. That is another important. But in between the toes, it should be dry. This is also very important. Then you check your blood circulation, nerves like Doppler, biotissimeter, anti-scope and foot pressure studies at least once in 6 months with your doctor. This is very, very important because you can pick up the changes very early and save your foot from complications later. So have it done. Then next thing is, there is a slightest change, any slightest infection, any foul smelling discharge, any change you notice in the foot, go to your doctor immediately and have him treated appropriately. Preferably go to a diabetologist, and then if you refer to a diabetic foot surgeon, go to a diabetic foot surgeon who is trained in managing diabetic foot complication. This is very important. Okay, so you should take care of your feet like you take care of your face every day. So imagine how much time you are spending for your face every day. You must spend that much time for your foot also, particularly if you are diabetic. This is very important in the long run and it will save your foot. Wish you all the best. Thank you.